Dave, please confirm whether my screen is visible.
Yes, it is, Dr. Kamau. Kindly go ahead.
Thank you very much. Welcome, listeners, welcome viewers, welcome participants to this very important topic of infodemic. When a thought came into my mind in discussing this topic, it is because of realization how much effort has been put by the international agencies and governments to fight COVID-19. But in my view, there was an obstacle that has been placed in those strategies and those efforts. And this obstacle is what we are now calling infodemic. So this presentation, basically, I'm going to talk about infodemic as it has come to be known. And I want to believe that later on we can share information, we can share thoughts with a view of seeing how we can remove this this obstacle called infodemic from the strategies and the efforts that governments and international agencies have put in the way of fighting COVID-19. Now, in way of basics, I just want to start at very basics, because what we are commonly used to in public health terminologies, we all know what a pandemic is, we all know what an epidemic is, and we all know what an endemic is. And now, in addition, and in advent of COVID-19, a new term has now emerged. And this term is what is now called infodemic. And the question now, what is infodemic? Sorry. According to WHO, infodemic means an excessive and uncontrollable flow of information about a problem, which makes it difficult to identify a solution for the problem. And this indeed has been the case. I know when I speak like this, everybody will identify with this issue. You have seen stuff in the social media that sometimes you know right away this is not true, because perhaps you are a healthcare provider, you're a healthcare trained person. But in the mind of people who are not in healthcare, they tend to believe, or they tend to be shocked. And that belief, that shock, becomes an obstacle for them to uptake strategies that the government may be putting in place to fight COVID. So infodemic is simply excessive and uncontrolled flow of information, which in itself makes it difficult to identify a solution and for the problem to fight the problem. And why is it a concern to us? Why is infodemic a concern to us? It's because it has potential to distort and throw into disarray disease intervention strategies laid down by governments and international health agencies. Infodemic can also hamper an effective public health response and create confusion and distrust among a people and among nations. When I say this, again, I am sure I am addressing people who have had confusions that early last year, March, April, May, there was so much going on about COVID-19, and there was so much speculation that when we talk about confusion and distrust among people and among nations, I think what comes into mind is how much distrust we had about China. At some point, information went around that this virus was manufactured in China. In our mind, we kind of started conceiving China as an enemy of the world, but there were no proofs, there was no evidence. But many people actually consumed that and believed it. Perhaps some of them stopped believing it much later when information starts unfolding. But there are many people, even up to today, who still believe that the virus was made in China. So that makes us get concerned about this thing called infodemic. During global health emergency, like the one we have for COVID-19, infodemic spreads rumors, it spreads fake news, it spreads false information, it spreads myths, it spreads misconceptions, and it also spreads a mixture of true and false information. And what are the opportunities for infodemic? In other words, what ground becomes fertile for infodemic? One of them, and the key one that Dave has alluded to, is the recent advances in technology. And this is mainly information combination technology, the presence of social media, Facebook, LinkedIn, Telegram, the lot, we know them, WhatsApp. These are platforms that are capable of spreading information terribly fast. And when that technology is in the hands of good communication skills, if a person is a good communicator and the person puts false information with good communication skills, it tends to be believed, it tends to be interesting, and people are much more likely to share that information. Now, the other opportunity is the position of authority. When people in authority speak, they are likely to be believed more than an ordinary person. In mind comes the pronouncements that were made late last year by the president of the USA, Donald Trump, the pronouncements that come in mind that were made by our neighbor president of Tanzania, Pombe Magufuli, and of course the list can continue. When people speak and they're in a position of authority, people are likely to believe and consume that information, whether it is correct information, false information, or a mixture of true and false information. The other opportunity for infodemic is a curious, concerned, worried, and confused audience. This is the case now with respect to COVID-19. It was much more so last year, and when it first came into being known and spreading very fast all over the world and killing very many people. People became curious, people became concerned, people became worried, and within that, they also became confused. And because they are confused, anything you say is likely to receive listenership. And when at the end of it all, they will choose to believe or not to believe. But because they don't know anything else, they are likely to believe what they have heard. And of course, the other opportunity for infodemic is information vacuum created by lack or uncoordinated formal source of correct information. Here in this country, we are lacking here. Perhaps this is the baby step that we need to take to realize that infodemic is a very serious obstacle towards fighting COVID. And recently, from last week, towards rolling out one of the most important tools to fight it, and that is the vaccine. Personally, I had the vaccine. I was the 6th person to be vaccinated last week. And when I came back home and talked to my kin, and others saw me in social media that I have been vaccinated, I am shocked with the results of the mentality of people. Some of them were like, hey, how do you dare? Hey, how can you do that? I thought you know more. And I'll tell them, of course, I know quite a bit, and I know this thing is safe. And many of them were like, okay, let's wait and see. In fact, a joke is going around because I play golf at Ruiru Sports Club, and there was a competition, a big competition on Saturday. And when they learned that I had had the vaccine, and they asked me on social media platform whether how I was feeling and whether it is real safe. I told them I'm feeling okay and this thing is real safe. And there was a joke that was posted on WhatsApp that was saying, okay, let us see your scores tomorrow, Saturday, after the competition. Now, that was a person who is knowledgeable, a person who is held in high esteem in society, but the kind of disbelief and the kind of information they have is so distorted that we know because of their position, they are going to get listened by those who they talk to. And that becomes a very, very big and important and serious obstacle towards rolling out COVID-19 fighting strategies. Why do people engage in infodemic? One would ask. Now, the first thing is to spread propaganda. I don't want to say this is an area that I have studied very much. I've just done desktop research, but I believe there is a very fertile ground for serious research by social scientists to study this thing called infodemic. I've come to know that one of the reasons why people do this is to spread propaganda, and the other one is to instill fear in people. And other people do it for the purpose of trade and financial gain, and especially if they are promoting products that they think people are likely to believe that they can protect themselves from COVID. And people buy stuff, spend money on useless things that may not be of much use in terms of protecting themselves from COVID-19. And the other reason why people engage in infodemic is to propagate certain beliefs in a people. I'm sure when I speak like this, people know certain religious orders and religious groupings that have certain beliefs with respect to COVID-19 and vaccines in general. And these people must be talked to. We must have strategies where we are talking to these people and making them fertile for consuming correct information and disseminating the same. The other reason is to mass sweep emotions across a people in order for them to achieve certain objectives. People in politics sometimes may use certain types of information that whips emotions across a nation in order for them to achieve certain political goals. And this becomes now another very serious obstacle to fighting COVID-19. Thirdly, infodemic can be one, interesting. I know we all know this. It can also be entertaining. We all know this. And because of the above, it creates a fertile ground for it to be believed. And once a person believes certain information they have seen on social media, they readily circulate it, especially by people, a non-judicious mind, people who do not give a second thought to what they have heard, seen, or read. And they just circulate and it becomes viral. And once it becomes viral and it's all over, then you find that more and more people are believing what's going on. And that's the reason why they're sharing. Examples of infodemic many of you just mentioned a few, many of you have had. You had early last year a cure for COVID-19, and this was highly promoted by Donald Trump, the president of the USA then. And you have also had a myth that COVID-19 is a Western ill-generated agenda with ill motives, and it does not exist. This has been promoted by Pombe Magufuli of Tanzania. And we all know this, even though we know the situation has now started changing and the perceptions are changing. We do not have full information as to what is happening in Tanzania with respect to COVID-19. But again, if we were to depend on information filtering through, it's likely to be used in a laboratory in China. Again, we have on this, we can only consider this. We have also heard that consuming large quantities of ginger and garlic will prevent contracting the virus. We know this is a fallacy. And we also have had herbal-based cure for COVID-19 emanating from Malagasy, where the president, Andre Rajoelina, had said that there's enough of that herb that is capable of fighting COVID-19, enough for their own use and enough for export. So these are just examples of information that is not true and the information that makes it difficult for us to fight COVID-19. Now, in the words of Dr. Tedros Adhanom, who is the Director General of WHO, he says, "We are not just fighting a pandemic, we are fighting an infodemic." In saying this, he was referring to inaccurate, false, mythical, and fake news that spread faster and more easily than the coronavirus itself. The continuing effects of infodemic, now that it has infiltrated the global vaccine rollout program, we know infodemic is playing a very big role, and I have an experience on it. I can now speak authoritatively on this. And that's why I feel concerned that we don't appear to have a formal strategy to fight infodemic and iron that pathway, which will make it easier for this country and the international community as a whole to fight COVID-19 using vaccines as a tool. This has the effect of raising skepticism and vaccine hesitancy amongst the populations. Now, and how can we discriminate infodemic from true or correct information? Yeah, and this is perhaps the key message to my presentation today. First, to the healthcare providers, because they are as affected with infodemic as the general public. Even amongst healthcare providers, there are many who harbor information that is not correct. And because they sit in a position of authority, professionally speaking, they are likely to be believed when they speak to the general public. And therefore, we need to start with them and teach them how to discriminate infodemic from true or correct information. So the question is there a way of telling infodemic from the truth? The answer is fortunately and yes. And the way to do this is very simple. Check the source of that information. Your safety lies in the source, and this cannot be overemphasized. It's the key. It's what we should be telling people. Check the source. Where has that information come from? Now, even as we check the source, we know it's people who will be speaking from that source. And experts who are likely to be believed are likely to have spoken on behalf of their reputable organizations. And these are people who we are likely to believe. Experts who speak for their reputable organizations. And we are going to see who are the reputable organizations in a second. And as we speak, as we listen to experts, we must also worry and be very careful about experts who speak of their own opinion Because if they have a certain distorted beliefs and they are experts in public health or in the area of COVID, it's going to be very dangerous for us because people are going to believe them, and yet they are not speaking or they are not disseminating information which is based on science, but based on certain beliefs that they may have. So I cannot overemphasize checking the source. It is where our safety lies. And who are now our reputable organizations? Of course, WHO. If it's not coming from WHO, then it is not true. If it's not coming from UNICEF, it may not be true. If it's not coming from CDC, it's not true. If it's not coming from the Ministry of Health or any of its agencies, then you need to question it. This list is not exhaustive. I just listed 4. I know there are many more reputable organizations, but the key message here is you need to identify a reputable organization, and when you see information coming from there, then you are likely to know it may be true, but be careful whether you are listening to a person who is an expert who is speaking on behalf of their own organization, or an expert who is speaking and giving their own personal opinion. In way of recommendations, as a nation, we need to formally recognize Infodemic as a serious obstacle to managing coronavirus pandemic and the vaccine rollout nationally and globally. 2, we must seek to understand the genesis and the objective of every piece of myth, misconception, false information, and COVID-related propaganda as soon as it emerges in the social media platforms. And 3, we need a formal and well-coordinated strategy to debunk and bust every myth, misconception, false information, and COVID-related propaganda as soon as it emerges in the social media platform. In conclusion, Infodemic does not respect education status, social status, culture, religion, or political inclination. Infodemic is consumed in equal measures across the board. 2, healthcare providers, opinion shapers, community gatekeepers, and mainstream media must be specially targeted with the correct information so that they can become agents to disseminate the correct information. And 3, this effort must be continuous and without interruption for it to bear fruits. Thank you very much.
Okay, thank you very much, Dr. Kamau, for that insightful presentation. Of course, it has given us very good insights on what Infodemic is all about. I'd like to inform the listeners that at the end of our presentations, we'll be inviting questions. So we can be sending our questions through that Q&A tab at the very bottom of your screen. You can be sending us questions at the end of this presentation. We will be asking our panelists the very questions. I'd like to invite Mr. Halim also to give his presentation on the same. Mr. Halim, are you ready for that?
Thank you so much for inviting me, and it's a real honor and a pleasure to be here. I'm just going to share my screen. If you can give me sharing rights. I hope you can see my screen.
Yes, I can. Yes, we can.
Okay, fantastic. Thank you so much. So once again, thank you for having me today. My name is Halim, and I'm the Crisis Communications Officer for WHO Afro. I'm going to speak to you today about the Africa Infodemic Response Alliance and the work that we are doing at WHO to respond to health misinformation and information gaps. So we have launched this alliance last year, and it's composed of 30 members. As you can see, we have a number of trusted public health organizations. Of course, WHO, UN Global Pulse, which is the UN Secretary General's initiative for innovation and big data, UNICEF, IFRC, Africa CDC, Gavi, the Vaccine Alliance, UNESCO, and UN Verified, which is the UN Secretary General's initiative to fight misinformation. We are also collaborating with a number of, actually the biggest fact-checking organizations working in sub-Saharan Africa, including Africa Check, AFP Fact Check, Dubawa, PESA Check, Ghana Fact. And we are also collaborating with another organization called Midan that developed a tool called Midan Check that we have access to log misinformation. So the aim of the alliance is to limit the spread of harmful health misinformation and disinformation across the continent. And we do that through coordinating the response efforts done to curb in the infodemic, boosting infodemic research, strengthening citizens' resilience to mis and disinformation, supporting and empowering media partners to professionally and effectively share life-saving information and debunk mis and disinformation on health issues, encouraging proactive disclosure by data holders and through early identification of mis and disinformation trends, and providing a timely and a strategic response at a regional and country levels. So the framework that we're working with is called the Infodemic Management Framework, and that was developed earlier last year in collaboration with 1,300 experts in different fields and from different industries to kind of find a solution to this very complicated issue. How can we stop the spread of false and wrong information circulating online and across the community? So the Infodemic Management Framework is divided into 4 main pillars: identifying misinformation and information gaps, simplifying the technical knowledge and the correct information, amplifying strategically through the different channels the correct information and the misinformation debunks, and finally quantifying the impact of these different interventions. These 4 pillars form the basis for all of our responses. So when we launched the Alliance last year, we have identified a number of work streams that we are working on. So coordination, so making sure that all the different partners are working together and harmonizing resources and working on joint projects. Advocacy, so working and speaking out to ensure that the infodemic and infodemic management is high up on the list of priorities for ministries of health and for as part of the response for the COVID-19 pandemic. And research, so developing and monitoring the state of the infodemic and understanding, better understanding how health misinformation is spreading, who are the actors spreading them, and their motivations, etc. And there is also country support, and that's a tailored kind of support that we provide and work closely with different ministries of health and WHO, UNICEF, and country teams and other partners in order to provide a strategic and develop a strategy, an infodemic management strategy to curb the infodemic in the country. And lastly, viral facts, and that's the public face of the Africa Infodemic Response Alliance. So the Viral Facts Africa is a social media content intervention to disrupt health misinformation and to close the health information gaps. So we haven't officially launched Viral Facts, but we have done a soft launch, and Viral Facts will officially kick off by the end of the month. The idea is to create content that is more visual, engaging, shareable across different platforms, and in order to make sure that it's accessible to everybody. The added value here is that we're also hoping to co-create this content and to make sure that Viral Facts Africa is an African brand, and it's a brand of the people where healthcare professionals, journalists, and different stakeholders can work with us on owning this. We have made it very simple. So we developed a series of templates that are easy to fill and link to After Effects to be able to produce that kind of content, as you can see here on my screen. And one example that we produced was a video that reached about, in collaboration with Africa Check, and it had reached more than 7 million, was viewed more than 7 million times, with more than 312,000 engagements on Facebook only. So through these very easy format, we want to create content that would be debunking and correcting misconceptions and all of that. And this video was posted in December. There are different formats for viral facts content. It can be done in other languages, other UN languages, and in other local languages. And we're hoping to collaborate with other partners to make sure that the content is distributed and the content can be adapted to different formats and mediums like radio and TV as well. So, since I'm speaking here to a very well-informed audience, so I'm sure everybody's wondering what to do and how can we take this forward. So we've started this initiative to ask healthcare workers and different people to support us and to change the idea of a super spreader from a super spreader for the coronavirus to become a facts or a viral facts super spreader. So we need your help. We're building this network of healthcare, frontline workers, journalists, celebrities, community leaders, and students from across the region. And Kenya, of course, is one of those countries in the region where, due to the high internet penetration and due to the fact that it's a big media hub, misinformation, if it comes through Kenya, through Nigeria, through South Africa, or if it starts in one of those countries, it spills over across the region. So this is a risk, but at the same time, a great opportunity to work together on actually making sure that the correct information spills over all over the region. So what is the ask? The ask here is that we would like to work with you on sharing and amplifying the correct information. All the information that we use to produce in terms of video content and all of that, or social media content, is verified and cleared by the public health institutions that I've mentioned and the IRA partners that I've listed earlier. But at the same time, we want to make sure that we co-design this to make sure that it's easy, understandable. So if we're launching a campaign, we would like to hear your feedback. We would like to know, if we can co-design this together. So let's stop viral rumors and share viral facts. So how to do that? It's very simple. We've already, the social media accounts are already online. You can start sharing, you can start following them on Facebook, on Twitter, on Instagram. We have a link to subscribe to our newsletter and to identify your level of participation. If you just would like to receive content updates, or if you would like to participate more proactively in a co-design workshop, or just give feedback on content, whatever your level of participation, it would be hugely appreciated. And then after that, we can give you access to our asset or content hub, where we can have you can have access to the different pieces of content that we have, and we can also send you the links on social media if you would just like to share them right away without downloading and uploading. And it's very easy here as a way on how, a quick explainer on how to use the content hub, and that's it. And finally, when we would like, when you ever share viral facts content, we would really appreciate if you use the hashtags Viral Facts Africa as one word, in English, because that would help us quantify and better understand the reach of the content that we're producing and try to understand the engagement with it. So that's it. Happy to answer any questions, and thank you so much for your attention.
Thank you very much, Halim, for also that insightful presentation. So I'd like to invite Professor Anzala, to give his thoughts on this issue.
Thank you very much. I don't have slides, and also I wouldn't want to repeat what has been said, but I'll have just a few remarks, maybe 5 or so minutes. Fake news, misinformation, and conspiracy theories are, from what I have seen, beginning with HIV/AIDS and now with COVID, is actually intentional. And if one digs deeper, at times, it is well sponsored. And worst of it all, some of it is actually done by people who are well known and even experts in their various fields. But all these things, fake news, misinformation, and conspiracy, is then what is leading to what we are talking about, an avalanche of information. It is extremely concerning, because when it entails healthcare, then it undermines trust in health institutions and the kind of programs we run. But we must also be cognizant of what healthcare professionals ourselves have actually contributed. We have been sharing medical and other scientific information outside of expert circles before it has been thoroughly vetted and verified. There's been an avalanche of preprints, and definitely this has been on our own undoing. And unless we go back and begin to say, can we wait to verify? Can we wait for peer review before we actually release this information to the public? Whatever we do, this problem is going to continue. And I just want the audience to look back from March, maybe to December, and ask themselves, how many articles on COVID have been retracted? How many articles on COVID have actually been retracted? And that's where the problems are. Preprints. We wanted to consume before even the food is ready. And once you do that, that information gets totally out there, and to retract it, to say no, is actually already too late. Part of also the problem is that governments rarely make policy decisions solely on basis of empirical evidence. There's also a lot of political interest, and also governments want to be perceived to be in control. So when you do a preprint, they'll quickly move on. And even when you retract, they may actually never go back. There's been also an output of medical journals, so many of them that are also not completely vetted. Publications after publications. So even when we talk about how to deal with this kind of information, we must step back and say, what is a root cause? I come from the school of thought where there is a problem, we always want to do a root cause analysis. What is a root cause? You cannot climb a tree from the top. We must begin from where the problem has actually started. Those are some of the issues. So conspiracy works because it provides comfort for an explanation in terms of uncertainty and where there's anxiety. We didn't know about COVID. It sprung on us very, very fast and very quickly. So people who could come quickly and say, oh, it originated from here, it originated from there, before we could actually unpack it and understand, got away, very, very quickly. So those are the issues. And then it revolves around co-emotions and values, and then totally hijacks the way we think. So communicating the right information is not enough. We must go back and understand our emotions and our values and how we consume this information. Because even if I tell you, oh, the virus did not originate from a bat, that's not enough. How will I bring you back? How will I understand your values? How will I understand these other things to ensure that I can actually trace you back to begin to consume the information the right way? We must deal with emotions, we must deal with anxiety, we must deal with values in order for us to really understand what is going on. Because this thing hijacks our mental values. And what we are actually seeing is that somebody who is a vaccine skeptic will always go and look for information that is anti-vaccine. That's exactly what happens. They will always go key in and look for information that is anti-vaccine, which then reinforces their position. And then they actually feel happy because it deals on their emotions and it also deals on their values. That is where we actually need to go. For mental issues come in critically, how we consume information, how we make decisions. All these things must be looked in if we are going to deal with all the issues of an avalanche of information. Then the other aspect of it is that who benefits? There are people who are benefiting from this, all right? Corporate gains are there. The anti-vaccine industry, and I'm calling it anti-vaccine industry, is actually well-funded. It has almost 58 million online followers, and these social media platforms are retained because of what? Advertising. Even when WHO says we are going to deal with this, we are going to deal with that, that is the magnitude of the problem you are going to deal with. 58 million online followers and growing, all right, retained because of social media giants and advertising. The last time I looked and checked, revenues of 1 billion and counting. So it is not an easy problem. It is actually not an easy problem. But nonetheless, we don't do things because they are easy. We resolve issues because it is totally necessary. And then when we come closer to issues of vaccine safety and primary issues of vaccine concerns, there is now the issue of vaccine safety. But there's also around it issues of values about perception of low likelihood of contracting the vaccine preventable disease. There are people who feel their perception is that they are unlikely to get vaccine. So why? I mean, they are unlikely to get COVID. So why should they bother about vaccines? How do we deal with that segment of the population? And then there are those who perceive low safety of vaccine preventable diseases. And then there are those who believe that vaccines don't work. And then there are those who totally lack information. So as we begin to think about how to deal with this, we must categorize all these aspects and begin to say, how do we deal with each of them at every point? So these are really, very difficult issues, but at the same time, there are issues that we must be able to deal with. But as we deal with these issues, we must understand values. We must understand how we make decisions. We must understand ourselves, because just going to tell people that a vaccine works is actually completely not enough, and is actually not going to do, to do the job as we actually talking about. So the other aspects of it is individuals who totally believe, like in hesitancy, delays in accepting information, issues to do with where did COVID come from. These are people who delay in making decisions or refuse completely. Complex issues. But when you begin to look at these particular individuals, you find that there are also various factors that come in. Complacency. Individuals who feel they are just full of themselves. They do not need anything. How do you deal with those individuals? And then convenience. Okay? Those who proceed without any thought. And then those who are confident that really nothing is actually going to happen to them. Again, looking at pouring down to issues of beliefs and values. So we have a tall order here. I see this every day. I work with some of these individuals on a regular basis, locally and internationally. And for me, really, this is where the problem is actually coming from. Communicating at a higher level may not do, but the issue is that how do I move this complacent individual and move him over completely? How do I move these guys who seems very convenient in where he is and move him out completely? These individuals who feel so confident in themselves, how do I move him from his status and move him completely so that he will now search for the correct information? So for me, really, those are the areas I would like us to be discussing. Those are the programs we need to be putting in place, and also relooking at ourselves and asking ourselves, when is the right time to consume information? But from the scientific point of view, when we say follow science, when are we ready to actually put out that information that has been verified, vetted, so that we are not dealing with preprints that are going to be retracted 2-3 months later, and already the damage is done. Thank you very much. I'll stop there.
Okay, thank you very much, Professor Anzala, for raising very, very pertinent issues. Remember, at the end of the presentations, we're going to open up to our audience to ask our panelists questions. So I'd like to hear Dr. Ayah's thoughts on this issue. Is Dr. Ayah online?
Yes, I am.
Yeah, kindly go ahead.
Yeah, thank you very much. So just to follow on what Prof. Anzala has said and the previous speaker, I want to be actually quite boring in terms of the remarks that I'm going to make. I think one of the weaknesses, and then I'll offer some solutions. One of the weaknesses that we have, particularly in our society, is that we have very weak institutions, and over time, the trust that needs to be there in institutions has been eroded, so that where you would expect to be the institution you'd expect to tell you the truth has been whittled down, so that we now rely on individuals. And I think just going on what Prof. Anzala was talking about previously, was talking about we now look to particular experts to be our beacon of truth. And I think there is a danger in that unless we are able to build our institutions well enough that we can trust them, then we will have the problem that we're having, for example, with now the vaccine rollout, and also previously with with the whole COVID prevention, where people do not trust what they're being told. And they don't trust it at two levels. One is that they don't trust the person who is giving out the information, and they don't trust the motives of the person. Now that, to me, is brought about twofold. One danger we have with experts is there are lots of people who speak, but they're experts in one area, but they speak about something else. So you will find, for example, a lawyer talking about a health issue very authoritatively. And because they're an expert in law, they have a platform, they then talk about health of which they are better than average, but not the best. And I think when we're looking at sources of information, we have to look to that. And so there is a question about how do we build institutions so that when you now want to figure out, so what is the source of information? Now, previously, there was talk about, okay, we need to look to WHO, we need to look to Ministry of Health and so on. So you talk about international organizations. Now, WHO is an advisor of governments. And so whatever happens there should trickle down and should then be governments to take up that information and localize it for use by their population. So we have that huge gap, which I think we have to figure out. So we have to think about how do we get our schools of medicines across the country, our schools of public health, for one, and our research institutes to be the ones that speak out so that they don't just have a training function, but they also have a function around advocacy. And part of the solution to that is that we have to look at how it is that we fund particularly public health and also our medical training. Now, there's been a lot of under-resourcing. A lot of our public health has been donor funded. And so there isn't that importance given. And when we have a crisis such as what we have had now, then we see the weaknesses that exist. So that's sort of my first point, that we have to look at the structural problems around why misinformation is allowed to spread. It's because we have these weak institutions. The other point that I'd like to make is around the ethics of misinformation. Now, all health professionals swear some kind of oath to uphold life and so on. And when we look at it from an ethics perspective, one of the major tenets of ethics is to do no harm. So there is this thing, and I think many of us do this, where we casually pass on messages, particularly those that are sensational. And I think as Prof. Anzala mentioned, a lot of it is rooted in money. The more of this stuff you spread, somebody is making money from somewhere, but we're doing harm. I had the, what's the word I'm looking for? It was almost horror when I went to a lower primary school and I heard a 6-year-old talking about where the coronavirus came from, and it was total rumors. But this is a 6-year-old, and I wondered, how do I correct that without engaging them in giving them articles to go and read? It's really difficult. And already that's how they're talking. And so I'm wondering, this person is going to grow up, they're going for science lessons, but they will start to believe that rumors such as those are facts. So I think that the harm we do by spreading some of this stuff is really deep. It's not just something that is circulating amongst adults or amongst professionals. It's something that can really take root in society at a very low, right at the bottom of society. So I think from an ethics perspective, we have to look at this and figure out how do we do good? And in a positive manner, it means that particularly in a time of crisis like this, we have to be a lot more outward looking insofar as trying to engage with the general public at a level that they can understand. I'll pause there. Thank you.
Thank you very much, Dr. Ayah, for those insights. Before we open it up for questions, I'd like to invite Dr. Onsongo from the WHO. She wanted to put across a few points. Dr. Onsongo, are you online? Dr. Onsongo, is Dr. Onsongo online? Okay, we'll get back to her when she has that opportunity. I'd like to invite my colleague, Dr. Nancy Ngumbau, to just take us through a few of the questions that have been raised by the audience. Dr. Ngumbau?
Thank you very much, Dale, and to all our presenters who've actually given a really, really good presentation on the same. And that is being echoed in a lot of the comments that we're getting from Henry Kilemi, saying quite informative, thank you, team. From Chepkemoi, Jacqueline, who's saying nice presentation. So a lot of people are understanding the importance of this topic, and it's demystifying what is infodemics and how it plays a big role in even management of COVID-19 and even in terms of the vaccine. There's a lot of questions from our attendees in terms of vaccine hesitancy, and I'll give it to any of the panelists who can help us to address this question. So how do we deal with vaccine hesitancy? And the concerns are, the vaccine is here, and there's someone who's saying we don't have much information coming from the Ministry of Health. We don't have details concerning the vaccine. And someone else is saying the vaccine is here and people are not willing to take it up. So how do we deal with this issue of vaccine hesitancy?
Let me come in, not in way of answering that question directly, because I honestly want to direct it to Professor Anzala, but let me open up the road to that, the response to that question by saying this. One of the main reasons why we thought it's important we discuss this topic today about infodemic is because of the same issues that we are seeing being raised here about lack of information. And therefore, we are not discussing here because we have a lot of information. In fact, as we speak, as we present, and as we listen, we are also learning a lot. We are learning a lot from people. I'm seeing very good comments that whose answers I probably don't have, but they are eye-opener to the way we ought to be discussing and strategizing towards information flow that smoothens the path towards the fight of this COVID-19. Having said that, let me ask my colleague in the panel, Professor Anzala, to respond to that direct question. Thank you.
Yeah, thanks, Doc. What I'll do, I'll ask Richard Ayah to start. Ayah is on the COVID vaccine task force. So, Richard, talk a little bit about what this question is. What is it? Is it true there's lack of information? Can you allude to it a bit before I also say something? Ayah?
Okay, yeah, thanks, Prof. So I think, first of all, I'd like to question whether we really do have vaccine hesitancy, because to me, this is one of those things where one of the first things people came out with, and the people who are talking about that are very vocal. I can draw on the experience I've had so far. The first one is that when we did the launch last week at Kenyatta, there was a lot of enthusiasm to receive the vaccine. Now that's at a personal level. When we did the 2 days training, again, the other week where we had over 600 health workers from all across the county, the majority were eager to not only to learn about the vaccine, but to receive the vaccine themselves. And in fact, we did a few videos which we're hoping we're going to release to the MOH website on that as part of the advocacy. But the general sense I get is that partly, I think what has been expressed that, number one, it seems like the vaccine has taken a very short period of time. There was all those issues around COVID, Why is it affecting Africans? Those kind of questions that I think are genuine questions. But I would really challenge the narrative that there is a lot of vaccine hesitancies, because I just haven't seen the numbers on that. But notwithstanding, we have relatively slow means of communication. So what has happened with the vaccine task force is that we've engaged a lot of stakeholders. We've had various meetings through all the various groups, and we'll continue to do so to allay some of that anxiety. I think part of it is also related to the idea, which had sort of come up somewhere along the line, that somehow we are guinea pigs, that, you know, for Africans it's going to be a little different and so on. I think we need to debunk those myths. All of us on this forum have had one vaccine or the other. And at that point, because the vaccines have been around for a long time in name, but the particular variety that we're taking, we haven't really questioned. And that's a mandatory vaccine. Now we have a voluntary vaccine, which from what has been given by the same authorities is working. So I think we have to question, first of all, and I think this is part of what we're talking about rumors and so on. We have to question, first of all, the discussion that there is vaccine hesitancy in a big way. Where has that come from? Where are the numbers around that? Who has done those kind of studies? Then from there, we can begin to tackle the situation. Prof?
Yeah, I actually totally agree, you know, Richard. For me, really, we've talked about vaccines ever since we heard that the COVID vaccines had started being made and they were in clinical trials. So information has been there. On this forum on KNH, we have actually discussed on a number of occasions issues to do with vaccines. Even on various platforms, KMA and all the others, there has been discussions about vaccines and the rollout. So when I hear somebody says there's lack of information, then it's difficult to understand. But maybe the issue, Richard, is that maybe let's do more. Let us do more in terms of trying to reach out to healthcare workers in other forums, the nurses, the clinical officers, the technical staff, and maybe let's also organize forum just to talk to the general public. How we are going to do that, I don't know, but do it not from the point of view of TV stations, because TV stations always seem to have an agenda. You know, where I sit, and I can talk confidently about where I sit at Kavi and at our department. As of yesterday, all of us had actually been vaccinated. I got my vaccine on Friday. Quite a number of us got it on Friday last week. And by yesterday, nearly all of us at Kavi had actually received the vaccine, apart from one or two. So if there is hesitancy, let's know which circles there is hesitancy and try to deal with it, as you have actually said. Over.
Thank you very much for your response. There's a question here from Laban Mayo, who's asking, and I know we've had this presentation from Mr. Halim, but then is there something that's established, any establishment to combat infodemic in Kenya? And if so, how, what is that establishment and how is it done?
Thank you so much for the question. As I've mentioned, we are hoping to launch the Viral Facts Africa on March 30th. We are trying as much as possible to aggregate supporters and people who are interested in working together through the links that I have shared and that we have put in the chat box. But in terms of Kenya, the work in Kenya and country support, the WHO is working with infodemic management in Kenya. We have we're in the process of finalizing having a dedicated resource in our country office. And this resource will be working with the Ministry of Health and with the COVID-19 task force and the risk communications and community engagement technical working group on developing a dedicated infodemic management strategy for the country. The work that we're doing requires, and to fight an infodemic, it requires really a whole of society kind of approach. It's not just about health professionals, it's not just about the Ministry of Health, but it includes every single person to be on board. With the topic about vaccines and vaccine hesitancy, I just want to echo the other my co-panelists and what they were saying about the fact that we don't really have coordinated anti-vax groups in the African continent, like the way we see it in the global north and the United States and in Europe. We do, of course, have legitimate concerns and questions and information gaps around vaccines. And that's something that with the ministries of health, with the other partners, we're trying to identify quickly and respond to. And at the same time, using other means of communications, like, for example, we need to rely on WhatsApp more. Other than social media, WhatsApp is a massive source of misinformation, and we really need to kind of tap into that and make sure that there is a way to reach more people through that medium. Of course, the government has kicked off the 719 hotline, and that's an incredible effort to kind of support with responding to questions, but also trying to identify and triangulate all of the data, all of the misinformation, all the information gaps, and having a coordinated response through the whole of society, through the media, through the government, through the ministry, through healthcare workers, and making sure that there's a streamline of information is a massive task. And we're very happy to be that in Kenya, the ministry and the government is open to that kind of work, and actually one of the leading countries in seeking that kind of support. And we are happy to work with them and with all the other stakeholders and the community in Kenya to reach that goal.
Thank you very much, Mr. Halim. Dr. Jess Osongo, you can feel free to unmute yourself and give your comments.
Thank you very much for all the panelists and also for KNH, through Dr. John Kinuthio having organized this very, very informative webinar. My name is Joyce Nsonga. I'm from the country office, WHO. I advise in the area of communicable disease control, and especially in the COVID IMS, what you call the incident management system of the WHO Kenya country team. In fact, a lot has already been said through Halim, who's our advisor in the infodemics. But just to say that as a country office, this is an area definitely we very much wish to appreciate all the presentations already made, that it is an area of concern, and that it's important that we actually take action that we are already taking to bring the correct, there's so much information as we have seen, but a lot could be maintained or managed with the system. And I really like what Ayah, Richard Ayah was talking about, poor institutions. I don't know, it's Ayah or it's a professor. Poor institutions of trust. And this is an area we are really trying to put forward to have the correct reference point. We know WHO is one of the reference points in terms of health, but there are many other reference points that are also talking. How can we coordinate all information together so that we get out using the tools that are, the tools that are very fast, the social media, to upload this to the, not just to the high level, but to the public, which is really sometimes moving even before the information gets out of the area where it is being the source. What I can only say is that definitely the issue, as we have learned about the source of information, is very important. But I have a question for Professor Anzala. Actually, I was writing it, if I could maybe a clarification. You encouraged us very much about what are the challenges of infodemics? There's so much information, but some of the information is coming out of blueprint. It is so much a reference here. How then would you know which is correct and which is not? For example, we see papers, we have seen clips, we have seen, that's being sourced and it's all over there in the information that people are consuming. So how then is all this teased, validated? Is through institution or the management of the same. So this is what we could put across, that maybe at the national level, we do need these trusted sources that can tease out, filter out, and then filter toward even the lowest children are consuming in school. So this is what I can say at the moment, that we are working and we wish to work through the Halim, who's our expert here. We are recruiting other experts to help us put this together. So this was a comment and to say that we support this move on infodemics. Thank you very much, and over.
Thank you very much, Dr. Joyce Osongo. Those are really, really insightful comments. There's a question here from Edward. And the question is concerning infodemic based on community pharmacies, chemists, and lab. And this is where patients make the first visit before heading to hospitals. How do we help them to ensure that they provide the right and authentic information concerning COVID-19 and other epidemics to clients?
Let me come in on this by saying this in response to that question. Just like I said, we set up this webinar not because we knew everything, but because along the way we knew once we make the first baby step, we are likely to make big steps forward and be able to address the issue at hand. Now, what that question points to is an idea, according to me. Yes, we know, I think there is enough information that pharmacies and laboratories recently are the first port of call when many people when they get ill, and the people they find there are a potential, they are potentially very useful towards disseminating the correct information. The challenge there is the people they find may not have that correct information in the first place. So I think the suggestion that we are picking from that question is that we may, once there is a proper strategy and the anti-infodemic strategy is working, we are likely to involve such channels because we are able to reach the grassroots much faster than when we talk from the rooftop of the Ministry of Health. My take.
Thank you very much for your response. And that's a really, really great insight. There's another question here from Gilbert Makoha in terms of our leaders and their opinions. A lot of our politicians and leaders, even the religious leaders, usually have opinions towards COVID, towards the vaccine. So how do we help in such areas such that they do not spread the wrong information and they disseminate information based on facts on all health matters at all levels?
Just ask the question again. Somebody stepped into the office, so I didn't hear. The question was what? Sorry about that.
The question is on infodemics and leadership. And Makoha is asking, so around community the general public is based on opinion leaders and community. for all health matters at all levels.
If I may respond, really what we must do as a country is to develop strong institutions and even develop think tanks where when there are issues of this nature, and there'll be many issues, health, agriculture, and all these other issues, really we need think tanks. We can cascade from what WHO is saying, but at a country level and then a regional level have think tanks where a reference will be made. This will be the reference point to talk about certain issues. And if that think tank has given a position, then indeed that is actually the correct position. But as Ayah has said, when there is no structure, anyone and everybody speaks. And then people, because of value, will pick what they think is in line with their value and go with that. So really what we need to do very, very quickly, and I'm glad we are talking about this, if any organization can begin to think of beginning to put together think tanks that can allude to various sectors. Health is a huge sector. Agriculture is a huge sector. Okay, education is a huge sector. So that there are think tanks who will actually deal and give, the correct information on a very regular, basis without even being prompted. To me, that will actually be the right way to go. And then to answer what Joyce Otsongo had requested, is that with COVID also came solicited publications. I can share with you my screen where on a daily basis I'm getting 10 to 15 journals that are requesting for publications, meaning that whatever you put in will be published. So the discussion now we are having at a scientific level, how do you get rid of those kind of journals? But if we move to the whole issue of having think tanks, then within the website of a think tank, you can actually go in and see that if you are seeking publications, if you are seeking information, then these are the journals you should actually look at. Because to tell you the truth, ladies and gentlemen, it's just going to get worse. It's just going to get worse. So the earlier we begin to organize ourselves as a country, from what Richard Ayah said, and then as a region, and then cascade what WHO has told us, then that will be actually the way to go. Over.
Maybe I can just chip in with a comment. So just to add on, so last year, around April, we started a blog website, kenyahealthsystem.org, where we means at the School of Public Health. And we got together a small team of the public health students, especially those who are doing policy and a few who are doing epidemiology, to start synthesizing some of the articles that were coming out. So we chose as our source of information, of course, the Ministry of Health, WHO, CDC, so credible sources. And the idea was to translate these into articles based on what was happening in Kenya. Now, one of the gaps in skills that is there is that the way in which we train our students especially is to do a thesis or a project that's going to take maybe a year or longer. So we have this thing about taking a lot of time to do research, and what policymakers want, and the public even more so, is very quick turnaround. The situation is now. I want to know about the vaccine now. Now, the skill required to be able to synthesize information and then write it in layman's term is somewhere between science and journalism. Now, in a sense, I'm lucky that I have managed to interact with a few of there are a few scientists who have taken up journalism, and I think we know some of them, but they're very few, and there are even fewer journalists who understand science. So we have a huge gap there in terms of translating the science that is out there. And so even that is a little bit of a gap. I mean, I'm happy to say now that at least I know that we have maybe 5, 6 people, students in MPH, public health, who can now write articles. They can put together and synthesize, and it can come out. But it's a skill that also we have to build up and not move away, but add it to the skill of being able to take a year to come up with primary research. Thank you.
Thank you very much for your insights. We're almost coming to the end of this session, and would really like to give credit to Dr. Kamau for even bringing this topic up, that it's a topic of discussion, it's a topic of great importance. Maybe one final question, even as we come to the end. Several people are asking, is it illegal in law to give misinformation or disinformation? And how, if it is illegal, how is usually this prosecuted? What are the penalties for fake information?
I speak not because I have an answer to that question, but it's a very key question, because we know there are certain, I would say it is illegal to transmit certain information with regard, for example, to pornography, with regard, for example, to false information appertaining to a person or to an institution. But with respect to medical or scientific information that is incorrect, false, or a myth, I would like to ask Dr. Richard Ayah whether there is anything that he has in this respect, or shall we be left to go and find out, and with an objective of filling that gap, if it turns out that actually there's a gap in that respect. Thank you.
I think let me say something before Richard Ayah says something. I have seen in this country bloggers being arrested for false information. Maybe this is mainly pertaining to, to politicians. But I think that propagating false information is illegal. But I believe this can be done through our regulatory organizations. For example, if we have these think tanks and a medical doctor for that reason is actually propagating false information, then our regulator, the Medical and Dentist Council, should actually take a legal position against this particular individual. So, but these are things that maybe as healthcare, because we are healthcare workers here, we need Kamau and Richard Ayah, we need to move, further and pursue this so that we echo what our president always says. And one of the things I like about our president is kusema na kutenda. So what we should do out of this meeting, there should be some bulletin that something will come out of it in terms of dealing with illegal information and actually misinformation that can be dealt with at the level of the regulator. We are all regulated, be it clinical officers, nurses, doctors, we are all regulated. We are all certified. So that's where really the critical aspects of what we say and what we do, what we don't do, should actually come from. Over.
Thank you for your response, Dr. Anzala. I think whoever the person who has that question has already contributed in a big way to this debate, to this webinar, in terms of stimulating our thinking, so that where gaps exist, we may move to attempt to fill them. I will be taking up this issue about infodemic to the board level at Kenyatta National Hospital. And the objective, my objective will be that it will be cascaded at the departmental, at a relevant departmental level, so that it doesn't just become speaking, just like Prof has said, but we want to start seeing action in terms of strategy groups, so that going forward, we have, call it a task force or a think tank that will be addressing infodemic from the hospital, a nucleus around which even the rest of the professionals in the ministry will come and populate, and so that we can see action and the way forward with respect to infodemic. Thank you.
Thank you very much for those comments. We've come to the end of this webinar session, and it's been really informative and very key in addressing the issue of infodemics and how we will be able to combat this, even going forward with new epidemics, new vaccines. I know several people are asking about how do we register for the WHO platform, and that has been put on the chat. So kindly look at the chat and you'll be able to see the link to register for viral facts. And you can give comments, give feedback, as Mr. Halim had said. Even as we come to the end of the session, I'd like to give our panelists a few seconds to give their parting shots so that we can end this webinar.
Thank you. I don't have much to add. Actually, I think what I said last was my parting shot. Let me give an opportunity for the others to say something. But even so, may I appeal to all those participants who have participated here to start thinking about infodemic, to empower themselves by reading around. I know people become stimulated to research more on a topic they have had. And I am confident that when you go, you will find there's much, much more than you have had. And my appeal is that we move from talk to start talking the talk. Thank you.
Dr. Ayah?
Thank you. I'm really happy. I'm a systems guy, so I'm really happy that this topic has come up and we're discussing. Remember, right at the beginning of COVID, one of the things that was said was that COVID will find us out. It will reveal how our society is structured and what we have prioritized and so on. And I think talks like this are bringing this out, in the sense that our institutions have been weak. We have focused on training, and now we have realized that we really do need to engage society fully in terms of what it is we do and how we conduct our health. So I'm happy that this is coming up, and I take it as a challenge of something that we need to address. Thank you.
Professor Anzala?
Yes, thanks a lot. This is really great. These are very, very topical and important issues. So for me, the new normal that we are actually, talking about is not just wearing masks, social distancing, and sanitizing. The new normal also is beginning to deal with this avalanche of fake news, conspiracy, and misinformation. And for me, is actually to urge Dr. Kamau, let us not just stop at a webinar. Whatever you have suggested, let us get starting. And as I said, we don't do things because they are easy. We do them because it is necessary. And COVID is teaching us that the new normal is actually beginning to deal with misinformation. So let this be the beginning, so that the next time we shall actually be having information that we have chatted out, and we have our own local information to say that we are now having 5% hesitancy, and those who are hesitant are A, B, and C, and this is how we need to deal with them. So that new normal will also be about finding facts on the ground. So that's, for me, what I'd like to see come out of this webinar. Thank you.
Thank you, Mr. Halim.
Thank you so much. I just wanted to thank you again for inviting me, and it's a real honor and a pleasure to be among those co-panelists. Very excited to start the work. This is an incredible platform to kick off the conversation. I'm very excited to hear about the KNH's initiative to take on Infodemic and countering misinformation. We're here to support. The country office is here to support, and with whatever is needed, we are available, and we're here to engage with anybody who's interested to take this topic forward. So thank you again. Over.
Thank you very much to all our panelists for the presentation that has been made. We'd also like to thank all our attendees for sitting in and listening when we're discussing matters infodemics, especially during this COVID pandemic. And as you can see on your screen, today evening at 7 to 8:30 p.m. we'll be continuing a series on sexual harassment, and this time we'll be talking about sexual and gender-based violence, the medical legal issues pertaining to that. So feel free to join us today evening from 7 p.m. to 8:30 p.m. and we'll have a really, really interesting conversation concerning sexual and gender-based violence. So for that, I'd like to wish you all a very good afternoon, and thank you so much for joining. Have a very nice day.
All right, bye-bye, and thanks very much.
Okay, bye-bye, everybody. Bye-bye.
Thank you. Bye-bye.
Thank you. Goodbye.